My name is Lawrence Stender. Today I'll be talking about healthcare allies in AI. Today's topic is clinical informatics, and downloading an app can change your perspective. We also have a QR code on our Instagram page. If you use the Instagram app, go to your camera. You can QR scan this. And again, you can find us on Instagram at Healthcare Allies in AI. So I have a quick icebreaker. The question is, what one healthcare or app you used recently? For me, I use ChatGPT each time I have a stomach ache. So I usually give it the symptoms, and then I'm like, oh, okay, should I take Pepto-Bismol or like the chewable antacid stuff? Just a fun way of just using, technology today.
Yes, one app that I use is to help me track my calories. It's a new app that uses AI. So as I'm working out, I want to make sure that I'm in a calorie deficit, and there's a new app that allows me to do that. So that's really interesting right now.
And so if it's not an app or anything, sometimes, people use like Google search to just see what symptoms and if it's related to something so bad or serious. Because each time I Google search something, I'm like, oh, hopefully today is not my expiration date. So it's good to have like apps and things like that, especially like the Fitbit. Those things, I swear, if I can keep up with one, I'm always losing it. So to me, I'm just like, oh, okay, I gotta kind of make sure that my health data is also on the app too, right? So next, I'll be going into healthcare allies and AI. So we are a multimedia platform service that shares update on AI and healthcare. Transitioning from a traditional mindset to a more innovative approach. We can all collaborate to understand the significance of healthcare data and fostering trust, ethics, and transparency in the governance. And then who is an ally? So an ally can be anyone. This fun visualization right here. You could be a student, you could be a doctor, you could be a community advocate, a patient, a caregiver, someone from tech, bioinformatics specialist, an analyst, also a PA. And so again, anyone could be an ally because again, we're all in this journey of in this big data era. And then again, we need people like you, no matter if you have a unique experience of your healthcare background or a unique experience of working in data, digital health, or anything in tech. It could be coding, anything. Because again, this service here and this platform here, just to give each one a chance to share like, unique experience, resources, and connections. So today, we have today panelists. Uh, my name is Lawrence Tinder. I'm a recent graduate from Georgetown System Medicine program, located in Milwaukee, Wisconsin. And my background is in genomic and translational research. So I also did cancer research over the semester. And my colleague here is Ranisha Blake. She could talk about who she is and her background.
Hi, everyone. My name is Ranisha. I'm also a systems medicine graduate from Georgetown. I specialize in healthcare and AI, and I'm really interested in clinical research and more specifically into cardiovascular medicine. So happy to be here.
Thank you for being here. So next, we'll have this is our today theme, how don't downloading an app can change your perspective. Again, we're always on our phone 24/7. Sometimes I don't like to be on it all the time, but it's good to know that there's apps here in the today time where we can just download and also monitor our health and also share unique experiences. So we'll just dive into today's topic. So Epic. Epic is a huge vendor in the Midwest. So Epic also provides apps on a clinical level, especially in those working in the healthcare system and also those who are using the healthcare system. And so there's other cool apps like Access Medicine, where Access Medicine is a um, point of care diagnostic tool used in clinic for dermatology. So those who, want to see other skin conditions or just see a unique rash, there's tools and apps like this that can highlight to say, oh, okay, a Google search wasn't helping me to see a rash, but an app like this actually helps. And then you have X Health. X Health is another app that's been used in the clinical spaces where a lot of times patients are requesting updates or re restock of their medication. And so that signals to a lot of physicians in their clinic space to see if there's any update or any change of supplies. So also has another streamlined system of manufacturers and supply chain. And so again, it's collecting on-time data of medications and prescriptions that's being digitally prescribed. And then you have Visual DX. Visual DX is another cool app that's used to aid visual conditions, especially with a lot of huge data sets. Maybe you have a sty in your eye or glaucoma in one eye. This app in itself help educate both clinical spaces and community spaces about those. And again, Epic is today's topic, and as the vendor that we'll talk about and when thinking about downloading an app. So this video just shows that Epic website portal shares a lot of unique information. So we'll click on health system and clinic. This is to highlight that there's a lot of software behind the acute inpatient care, primary care, specialties, and post care. And again, revenue cycle and life science. And so if you were to go on the Epic website and go under the software tab, you can find this information. And this information is just highlight that there are system at play to help you streamline when you do a visitation, when you have post-care options, and also anytime you have a updated billing statement. And then currently we're moving to a genomic era where again, genetic sequence and that data will also be exposed into the EHR system. So in today's topic, just want to give you a definition of what is clinical informatics. Clinical informaticians transform healthcare by analyzing, designing, implementing, and evaluating information in communication systems that enhance individual and patient and population health outcomes, improve patient care, and strengthen the clinical patient relationships. And so this is clinical informatics. It's a field, it's a title, it's a role to help sure that data that's being collected for EHR systems are actually useful and that actually helps the institution question or a physician or research question. So there's three types of EHR, and the long version of EHR is electronic health records. You have your personal medical record, you have your electronic medical records, and you have your electronic health records. And so again, EHR encompasses these three types of different platforms. And then we will move on to the EHR vendor, again, Epic. From a United States map, we see that Epic is very popular vendor. It outsources its resources to not only the state of Wisconsin, but other states, other hospitals, other medical institutions, and clinics. And so, again, when you look at statewide, you see that PMR, EMR, and then EHR, right? So PMR is usually the state records of your personal medical records, so you can get care within one city to another or across another jurisdiction. And then you have EMR, where it's localized into more of a hospital institution. So in the state of Wisconsin, we have Froedtert Children's Hospital, and they're also pro health. And so with that being in mind, is that when it being checked in at Froedtert Hospital, will this information be seen in pro health? It may be in Madison, Wisconsin. And then for EHR, is usually localized in clinical spaces or pharmacy. So if I were to see a clinic here in the city of Milwaukee, my information will be accessible for the city of Milwaukee, but will be transcribed into the PMR and the EMR, and usually it does. So again, if I were to be in a car accident in La Crosse, my PMR record, my personalized medical record would be updated from my EHR. And if I were to move into the city of Madison, again, my EMR will actually have access to. So today, we're looking into My Chart as the app in mind that Epic has created. And this app, you can schedule an appointment, you can manage your prescription, you can view billing statements, and also, if you want to schedule a mammogram for a cancer risk screening, you could do that also on the app. Even when you get medical lab records or any lab results, it's always uploaded on the MyChart app, or you can also use it on the website service too. But you most likely get a alert for your upcoming appointments and also any new information that's being requested.